he said, there are those who see things the way they are and ask why. I dream of things that never were and ask why not.
Wow, Jim, your son did a great job with this montage of all the executive and stockholders.
Thanks. I think he captured every point of view, and I think he put them in a pretty interesting sequence.
Was it just me, or was Sammy in there 2 different times?
Well, so was Talia. The change has come, it's under our thumb, you know.
Yes, but Sammy seemed to give 2 different opinions.
Well, yes, now that you mention it, at first Sammy covered all the facts, and then Sammy turned very, very negative.
Yes, except the first time he pointed out the fallacies of the bill.
No, accuracies.
No, the fallacies.
No, accuracies.
No, fallacies.
It was facts and accuracies.
The fallacies.
Stop. You're both right. First, he pointed out the pre-existing condition ban, but then later said it was shoved down our throat.
So which is it?
Well, let's call Sammy and ask him which one is right.
No. I told Dan we'd be done with this tonight. We have to decide right now.
Just have him cut out one of the Sammys and let's move on.
Okay, but which Sammy?
It's easy. Cut out the right-wing Sammy.
Okay.
No, cut out the left wing Sammy.
Cut out the right-wing Sammy.
Cut out the left wing Sammy.
Cut the right.
Left! Is he gonna be okay?
No.
We need to rethink this whole montage thing. Well, thanks everybody for coming to a special edition of Caduceus College for Healthcare Reform. As you guys probably know, Obamacare has passed. We thought it'd be a good idea to have all of our employees learn all they could about healthcare reform. Rebecca, why is everybody dressed in sports stuff?
Oh, that's because we're trying a new thing. Everybody gets to come to work and just wear all their favorite sports gear.
Oh, all right, whatever. Anyway, we thought it'd be a good idea that our staff really knows healthcare reform inside out so we can be better than our competitors. For example, we want to beat our big competitors like Kaiser. My God, Rebecca, what happened to these people? Sheesh. Okay, so I'd like to introduce a very special guest to talk about healthcare reform. He is a noted author, blogger, philosopher, and scientist. He stands for truth. He believes in principles over profit, and he rejects the propaganda from health plans, hospitals, and pharmaceutical companies. And best of all, he's always right, and he can prove it. Yes, I want you to meet my mentor, my friend, and my colleague. Yes, it's Sammy the Snake. Excited that the Sammy is here right in front of you live. But I thought, what better way to find out about healthcare reform from somebody who's never wrong, and he can prove it.
Yeah.
So, Sammy, since you're never wrong, we're not sure what's going on with this health care bill.
Okay.
Please tell us. Let us know.
Okay, perfect. All right. Well, class, here it is, short and sweet. First, the Obamacare is based on 3 very simple principles. 1, we want to provide health care for all of our Americans. 2, we want to reduce costs for individuals and businesses. And 3, we want to improve the quality of health care. Well, I'm here to tell you that this fails on each and every count. First, the Federal Accounting Office themselves have already confessed that at least 21 million Americans will still be uninsured under Obamacare. Second, businesses have already had to book higher healthcare costs due to the Obamacare mandates. And healthcare rate increases are higher now than ever before reform. They estimate $2.9 trillion will be the cost of Obamacare just for the first 10 years. I don't know about you. And third, they tell you that there's no quality improvement. They don't even mention it, nor do they define it. And I'm going to tell you there are thousands, millions of Medicare Advantage patients out there losing their hard-earned benefits.
Wow. Well, again, Sammy, thanks a lot. That was really, really good.
Hey, I'm not done yet.
Wait a minute. Weren't you just on my right a minute ago?
I don't know about that, but I can tell you this. Healthcare reform requires a medical loss ratio of 85% for large businesses and 80% for small businesses. This limits their profit. They either have to pay it to the doctors or lower the premiums. No more multi-billion-dollar profits for those big insurance companies. Take that, Kaiser. And with millions of Americans who cannot now get medical insurance, they're being put into a medical risk pool here in California. Kathleen Salabas of HHS has funded a major Medicaid cash infusion to allow millions to get coverage that could not get it before Obamacare. Once all employees must offer to buy health insurance for their employees and the healthcare exchanges are in place, then universal coverage will be achieved.
Well, thanks, Sammy. That really opened my eyes.
You're welcome.
What's going on? Sammy just took 2 opposite sides.
I don't know.
Yeah, who is right? If Sammy's never wrong, which Sammy's right?
What a waste of time.
Yeah, thanks for confusing us.
Well, hey, what's going on? Hey, what are you doing? What's going on? What are you doing?
Oh my gosh, Dr. DiNicola, are you okay? I don't know what got into them.
We got to rethink this whole casualty thing.